Knowing the symptoms of cancer is important for early diagnosis of the disease. However, having one or more of these symptoms does not necessarily mean that a person has cancer. Today, cancer is one of the most talked about and researched diseases, since it can be present in many different tissues and organs. It can present as different symptoms. There are many types of cancer. We are going to list them in a moment, so the signals in our body let us know which type of cancer we have. Now we will remind you about what you need to do by transferring these warnings to you in our body. First, let's find out what types of cancer are. Then the signals our body gives us will show us which type of cancer we can get. Types of cancer and their incidence are as follows. Cancers are classified according to their organ site and microscopic structure. There are about 100 types of cancer, but the most common are lung cancer, breast cancer, brain tumors, oral cancer, colon cancer, esophageal cancer, skin cancer, uterine and cervical cancer, ovarian cancer, prostate cancer, testicular cancer, stomach cancer, kidney cancer, liver cancer, pancreatic cancer, bladder cancer, laryngeal cancer, and nasopharyngeal cancer. Now let's talk about the signals our body gives. Yes, you should definitely pay attention to these signals. If you have some of them, you should definitely see a doctor. So, which ones are these? Wheezing and shortness of breath. Lung cancer patients say that one of the first symptoms of this disease is shortness of breath. Although there is no difference in your life routine, if you notice that you feel choked after climbing a few stairs or while walking, and this is a new situation that you are not used to, you should see a doctor immediately. Chronic cough and chest pain. Some types of cancer, including leukemia and lung cancers, can cause a bad cough or symptoms that resemble bronchitis. Some lung patients have reported chest pain radiating into the shoulder or arm. If you have a fever or an infection, these can be early signs of a change in blood cells that starts in the bone marrow. Leukemia produces abnormal blood cells in the bone marrow, hampering the body's ability to fight infection. Difficulty swallowing. Difficulty swallowing is often associated with cancer of the esophagus or larynx and can sometimes be an early sign of lung cancer. Swollen lymph nodes in the neck or masses in the neck and armpits. Swollen and large lymph nodes may indicate a problem with the lymphatic system, which can also be a symptom of cancer. If you bruise easily and have bleeding that does not stop, this symptom usually indicates an abnormal condition of platelets and red blood cells, which is a sign of leukemia. Over time, leukemia cells prevent red blood cells and platelets from functioning properly, interfering with the blood's ability to carry oxygen and clot. Weakness and fatigue. General weakness and fatigue can be one of the first signs of many different cancers. Therefore, you need to consider the picture together with the different symptoms, if any. However, if you feel tired and weak for no apparent reason, and it doesn't go away no matter how much rest you get or how much sleep you get, you should consult your doctor. Bloating and abdominal weight gain. Almost all women diagnosed with ovarian cancer report unexplained and sudden bloating in the abdomen, sometimes lasting for a long time. Not eating. One of the first symptoms of ovarian cancer is a loss of appetite and a feeling of fullness. Patients report a loss of appetite that started long before the diagnosis and that they feel full even if they eat very little. Pain in the pelvis and abdomen. Pain and cramps in the pelvis and abdomen, sometimes accompanied by bloating, are often early signs of ovarian cancer. Leukemia causes swelling of the spleen, leading to abdominal pain and cramps. Rectal bleeding or blood in the stool. Both are symptoms that usually indicate colon cancer. Blood in the toilet is by no means something to be taken lightly. In such a case, you should see a doctor immediately. Unexplained weight loss. Weight loss is one of the early signs of colon or other digestive tract cancers. It can also be a sign of a cancer that has spread to the liver, which affects your appetite, and the process of cleansing your body of waste, nausea, or abdominal pain. Experiencing abdominal cramps or frequent nausea should suggest the possibility of colon cancer. Breast redness, tenderness, and swelling. These symptoms may indicate breast cancer. It is important to be alarmed by any unexplained changes in your breasts and consult your doctor. Changes in the nipples. Many women report that they notice some changes in their nipples before they are diagnosed with breast cancer. If you notice that the nipple has flattened or turned to one side, you should consult a specialist immediately. Painful and heavy bleeding or bleeding between periods. Many women report that they recognize these symptoms as the first signs of cancer of the uterine wall or uterus. If you complain of heavier periods than usual or bleeding outside your period, it is important to ask your doctor to perform an ultrasound of the vagina. Facial swelling. In some cases, lung cancer patients report symptoms such as swelling or redness of the face. Small cell lung tumors often block blood vessels in the chest, preventing blood from flowing freely to the face and head. And this can manifest itself in swelling and redness. Lesions on the skin that cannot heal are painful and bleed easily. This can be an early sign of one of the different types of skin cancer. It is important to examine your body regularly and always be on the lookout for spots or lesions that change in appearance. Changes in nail structure. Unexplained changes in your nails can be one of the first signs of some cancers. A black or brown line or spot on the nails may indicate skin cancer. The enlargement and rounding of the nail tips, known in medicine as clubbing, can also be an early sign of lung cancer. If the nail color becomes pale or white, it should raise the possibility of lung cancer. Pain in the back or lower right side of the back is said to be one of the first signs of liver cancer for many cancer patients. Breast cancer is also often associated with back pain that does not go away. This can occur when the cancerous mass is pressing on the back or when the cancer has spread to the spinal cord or ribs. Finally, what should we do to prevent cancer? We will conclude our video with these points. People should try to maintain their ideal weight, avoid a one-sided diet, and try to consume appropriate amounts of all food groups, including meat, milk, cereals, fruits, vegetables, and fast during the day. Attention should be paid to eating 5 servings of fruit and 2 servings of vegetables a day. It should not be forgotten that pulp intake is very important in cancer prevention. For this reason, rye, bran, or whole wheat bread should be preferred instead of white bread. Fruits that can be eaten with their skins should be consumed unpeeled. Baking or boiling should be preferred as cooking method, and fried foods should be avoided. Food should be cooked without over roasting. Smoking should be avoided, and people should not be in smoking environments. Inactivity should be avoided, and daily physical activities should be increased. Doing sports at least 2 days a week is important for a healthy life. Drink 2.5 liters of water a day and reduce tea and coffee consumption. Half-fat milk can be used instead of milk powder when drinking coffee. Instead of drinks with these high sugar, the content of the dark such as acidic drinks and ready-made fruit juices, you can drink low-sugar compotes, pleasantries, or freshly squeezed fruit juices. Alcohol intake should be avoided. It is important to consume fish 2 or 3 times a week to benefit from the positive effects of the omega-3 fatty acids it contains. The frequency of consumption of foods with high oxidant content, such as broccoli, cauliflower, and cabbage, should be increased. Care should be taken to ensure that all foods are well washed and cleanly prepared, and clean water should be used. Frying oil should not be used repeatedly, and foods cooked directly on fire should be consumed at most 1 day a week. Daily salt consumption should be below 5 grams, and consumption of foods with high salt content, such as pickles, should be limited. Salami, sausage, and smoked food groups should be avoided as much as possible. It is important to consume 2 glasses of milk or yogurt during the day. Direct sunlight should be avoided, especially in summer. Yes, in this video, we have tried to explain to you what various disorders in our body mean. These may be signs of cancer, so it is useful to consult your doctor. Please do not forget to like and share our video and subscribe to our channel so that it can benefit others. We wish you all a healthy life. Goodbye.